come get radiotherapy with me. So walking in, they've got all these little superheroes on the wall, which are really cute. So this is what the room looks like. So I head in there, and then there's a little changing area just for me to get changed. So for my treatment, I need to have my top off because that's where there's zapping. So they just give you a little tissue just to cover yourself up with, and then I head on over and get comfy on the bed. So once I'm settled, they start to raise me up, and then they get ready to put my mask on. So some people will get a little tattoo, and some people get the mask, and some people get both. So all that is just so they can make sure they're lining you up perfect and you're in the same position every time for getting your radio. So yeah, I've obviously got the mask. Now, I'm not gonna lie, it does feel really tight, but that's its job. It's meant to feel like that. So my best advice is just try your best not to think about it. And if you do think about it, I like to imagine it as if it's a weighted blanket. So it is kind of cold in there, so I just kind of make myself feel like I'm cozy, if you get me, and it helps me anyway. So yeah, now they're just starting to put me in position, and then they're gonna start to go through all their checks to make sure I'm perfectly lined up and ready to go. This does take a wee bit of time, so again, just try your best not to think about it. As I said, it really doesn't feel like you're that high up, and with the mask, I think everything's better if you just don't think about it. So I really try and just take my mind off it here and think about anything else. So I wasn't allowed to video me actually getting the treatment, but I'm going to chat you through what happens when I get it. So for me, I need to hold my breath while I'm getting it, and I try to count how long it is, and normally I think it's about a minute and a bit I need to hold my breath for. So the machine goes round me 3 times. So the first time we do it with no stop, straight round, and then the next 2 times they give me a little break in between so I can breathe a little bit. But if you're someone who can't hold your breath, don't worry, because they can stop the machine. It's not as if once it's started it can't stop, so don't let that stress you out either. So yeah, my best advice is just try not to think about it. Side effects wise, I am definitely more tired, but it's not completely unmanageable. I just like to go for a wee nap when I get home. And the only other thing I've noticed is it is getting quite hard to swallow, but they said that's totally normal because where there's zapping, it can irritate your gullet, so it is quite a common side effect to maybe get a wee bit of pain swallowing. But they're the only things that I've experienced. I've put a wee clip in here of me coming off the bed just so you can see what it's like obviously when the machine moves round. So you can imagine obviously I'd be staying in that position and the machine just moves round me while I'm getting my radio. But again, it looks a lot scarier than it actually is when you're in there. I promise, it's really not that bad. I think I've covered everything, but if you have any questions, just put them in the comments and I'll get back to you. But yeah, that's me getting my radio. I'll also put some pictures in of what it looks like when I've got the mask on and I'm strapped to the table, because it does look a little bit funny. But yeah, the main things I'm just really like, I think it's so interesting the amount of things they can do with medicine now. Like, it's just so cool. I've got so many options in curing this cancer, so hopefully this one works.